A big 89 WLS and a great doctor, Kevin Most, joins us now. Senior Vice President, Medical Affairs, Chief Medical Officer, Northwestern Medicine at Central DuPage Hospital. And sorry if I misled you. I said he'd be on after 6:30, but, I'm just another pretty face.
Yeah,
You know
he's
what I
on
mean?
earlier. Yes.
Yeah, it's even better. Good morning, Dr. Most. How are you?
Good morning, Steve and AD. And
Hey,
Tom.
Dr. Most.
How are you guys?
We're doing just fine. And since we might get jammed on time, allow us right now to say Merry Christmas.
Yes.
And
Happy New Year.
And Happy New Year. My best to you and Patty and the kids and, of course, your whole family. My brother Mickey is visiting, one of your favorite people. And he wants to know when your mom is going to make him deviled eggs again. And I said, Mick, never. Never would be the answer. Because she had to dip into retirement, and she's broke now. That's how many deviled eggs you ate.
That was a funny day, that's for sure.
But we hope you have a great Christmas. What do you get at Dr. Most for Christmas?
Nothing.
Yeah.
But I'm trying to get rid of things, not take anything else
Oh,
in.
you're purging.
Yes.
Well, he announced his retirement, and, I suggested we shut down Northwestern Medicine. He thought that was a bit
I was going to
much.
say, to the dismay of everybody,
Yeah, but
every patient ever.
he's still going to do the show whenever he can. And I said, well, Tuesdays would be good. And he's going to dip his toe in several other things.
Golf.
I probably will play a little bit more golf. That is true. I'm not sure. I think my game has peaked, so now it's going to have to be just kind of make sure I'm going out there to have fun and not be aggravated.
Mm-hmm.
That's the thing that's hard to understand. You get to a certain point where you've had some success in golf, you've played at a decent level, and then golf is incredibly unfair because you can play till you die, but you get worse, as time goes on. And then when you have more time to play, you're not as good as you used to be.
Right. That's how I feel every round. I'm like, oh, wow, I really crushed it on 3. And then by the time I get to 8, I'm done.
Yeah, it's frustrating. By the way, Kevin and I will be out there cursing.
That'll be you guys.
Yeah, it'll be next summer.
You guys.
Anyway, thank you again, and let's jump in. Ozempic, still a good thing?
Well, it's really interesting. 2 studies came out over the last couple of weeks. One of them showed that many diabetics are stopping this medication within a year. So that's kind of concerning. If you remember, these drugs were made for type 2 diabetes patients. They really work well. And the sad thing is that they have some side effects that the diabetics can't tolerate, so they have stopped them. And then the other thing that's probably even more interesting is, when they were doing the research on this drug, they noted that people lost quite a bit of weight. So that's how it became a weight loss drug. Well, the study came out recently that showed that individuals that used it to lose weight but then stopped it gained that weight back, which just goes to show us that there's no quick cure for weight loss, that while you're using a medication like this, learn how to eat again properly, learn about exercise, so that when you do stop the medication, you can keep that weight off.
What about the other weight loss drugs, the Wegovy's? I know there's Mounjaro as well. Are those better for weight loss because they're not really pre-diabetic, Dr. Most?
Well, you know what, Andrea, it's kind of interesting. All these GLP-1s, and there's another class that'll be coming out very shortly, really show that they work for both weight loss and diabetes. So it's one of those where what's it better for? Is it better for weight loss or better for diabetes? We know that most people who are morbidly obese or obese have a tendency for type 2 diabetes, where they still make insulin. Their insulin just doesn't work as well. So it's a combination of both of those that when you lose the weight, you also cure the diabetes, the type 2 diabetes, which we've talked about for years. Weight management and exercise and diet, you can get rid of type 2 diabetes and get back to just normal health.
Will we see the cost go down of these two?
You know what?
That's the million-dollar question.
That is. They have sold, they're oversubscribed. I mean, you can't even get these drugs right now. So will they lower the price? I think, being the cynic that I am, unless they find some great new manufacturing way to make it less expensive, they are going to try to run this one out for its full, patent, and you probably won't see it drop for, a few more years at least.
$1,500 a month, is that the average price?
Yeah. So, it's one of those drugs where it can be life-changing. So It's expensive. However, insurance companies rarely pay for it unless you have type 2 diabetes, and the doctor's putting you on for that. But if you're taking it strictly for weight loss, it's often uncovered. Now, it will be interesting because that used to be when it was off-label. In other words, it was used for something that it wasn't approved for. Now that it's approved for weight loss, will insurance companies step up and pick it up? And I think you probably see more and more start to do that.
In regards to prescription costs, there were 10 drugs that had their prices reduced, and the Biden White House made a big deal out of it. It was a big deal, but 10's not enough. And we brought this up with Senator Durbin last time he was on, and there doesn't seem to be a firm notion on when the next batch of price reductions will come. I think this weight loss drug thing is interesting because even though it is something that seems to be with our own willpower and something we ought to be able to handle, therefore the insurance company has an argument against paying for it, it also is a growing epidemic of bad health in this country every day. And you've said it for years, Doc, you're going to pay me now, you're going to pay me later. So doesn't it make a little bit of sense for the insurance companies to at least cut the cost on this thing so people get healthier?
Yeah, it would. And for those, if when you're talking with Senator Durbin, a lot of those drugs that we're looking at right now for those are patients or drugs for Medicare patients where they're on a fixed income and they don't have the money for these newer drugs. So that's the focus there. But certainly insurance companies should be looking at this and saying, wait a second, if I can have this person lose this weight and now they're off their metformin, now they're off their diabetes drugs, now they have a decreased chance for all the other bad things that can happen with diabetes, boy, I'm investing on them now. So it does make a lot of sense as long as you can really hit home the importance of, if I was the insurance company, I'd say, you have to take, we'll cover this, but you also have to take food management courses and you have to show an exercise pattern. And that would make more sense.
Absolutely.
Yeah, but we're talking about making sense.
Right.
Come on.
Exactly.
America now, please. That doesn't happen. We have to talk about heart attacks and strokes over the holidays. You don't want that. And resolutions and micro resolutions and how to get some success to kick off your new year. First, man, it's just like a run of birthdays here.
I say, you got your granddaughter,
Abigail,
your son.
Abigail turned 8. Ross turned 33, and my mom's birthday's today.
Now, happy birthday to your mom.
Age withheld for the sake of my own safety.
Happy birthday, Ian.
So happy birthday, Mom. All right, so Doc. Yes, Doc was complaining to me off the air a moment ago. He said he's eaten more in the last week than he's eaten in the last year.
Oh, yeah, right. Christmas cookies, holiday parties.
Well, Andrea, I'll tell you, most people laugh at hospital food.
Yeah.
And I can tell you, we have the company that does our hospital food here is a company called Morrison. And I'll tell you, the chefs that we have
They're good.
Are unbelievable. They have prepared some wonderful meals for retirement stuff for me over the past week. And it's like, you guys, you got to stop. I can't do this. But they are just great and a great company, and we're fortunate to have them here because nutrition in the hospital is so important, and not only for the doctors and that, but actually more important for the patients that they can make the food taste as good as it does for such a large group of people.
Well, and it's a nice escape. It's a nice. It's not. I wouldn't even call it a cafeteria. It's a giant space to go and eat, and they're dealing with somebody that's sick in the hospital and need to get out of the room for a bit. You can actually go there and feel like you're in a restaurant.
Mm-hmm.
Mickey loves it.
Yeah, he's the best. He's the best.
Mickey didn't go with the healthy option last week, but yes, he does. All right, so speaking of healthy.
So we see a spike in heart attacks over the last 2 weeks of the year. Why is that? Does stress have a portion to play in that?
Absolutely. So, stress is a big portion of it. And when we're going to get a snowstorm at this time, it's going to be 50 and raining on Christmas Day, if I'm not mistaken. And last time I checked, we don't shovel rain. But think about it. That first snowstorm is often very heavy snow. And the amount of stress that you put on your heart doing that, just the emotional stress of the holidays with whether it be shopping or work or whatever is definitely there. And then really kind of really watching to make sure that you're taking your medicines appropriately. As we take days off, do we get out of our sync? Is our sleep pattern off? Do we forget about taking our medications? And then unfortunately at this time of the year, some people seem to take a little bit more alcohol in than they normally would.
You land on a plane there? What's going on?
they're drilling right below my office, I think, just to make sure that I leave on time.
They're taking the nameplate off the door already.
Yeah, it's funny. Today is 4 years since my last firing. This is my 4-year anniversary since the last time I was fired. And at the last place I was fired, the place that used to be a radio station, the car wash, they changed the lock on the door like ahead of time.
Did they really?
Yeah, the locksmith came in early or something. So I hadn't been told I was fired. It was a couple days later.
Did he tell you
I got him to give me a new key.
Did you?
Yeah.
Did he say, I'm just polishing your doorknob, Mr. Cochran?
I go, what are you doing? He goes, well, I'm changing a lock. I go, well, it's my office. He goes, yeah, no, I was told to change a lock. I go, oh, I need a key then. And they gave me a key, and I took it over to the general manager, and I go, hey, I got the new key to the office.
Thanks.
So the drilling can continue. We'll stand by.
Yes.
But in the meantime, there's something here I didn't know. And I don't know a lot of things, but I didn't know this. Wear a scarf because it helps prevent issues, right?
Absolutely. Scarves do two things. One of them obviously warms the air before it gets in and blocks viruses and bacteria somewhat from coming in. But we know when you're out in cold air, when you breathe that in as well as being exposed to it, your arteries and your veins constrict. So it decreases the blood flow, and then that can actually cause more stress on your heart. So certainly wearing a scarf makes more sense, not only for comfort, but actually is good for your heart.
Yeah, and the stroke question, Andre?
Yeah. Go ahead, Dr. Mercer. I know.
No. Go.
So many years ago, my father had a very mild stroke, and my mom knew she knew what was happening. He turned to her, and he couldn't remember. He said, "What's my password for the computer?" And she told him, and she thought, "Oh, that's weird. He forgot his password." Then he turned to her and he said, "What's my name?" And she immediately called 911. So what are the signs, aside from the obvious, that someone's having a stroke?
Yeah, so we just think of the acronym FASTER, FASTER, right? Face. Do they have an uneven smile? Do they have a facial droop on one side more than the other? Arms. Do they have arm drift? If you ask them to put their arms up, does one of them drift down or they can't keep that up? Stability and dizziness. Do they have a hard time keeping their balance? Are they falling to the side? T is talking, slurred speech, inability to find words like your father, unable to talk. And then if they complain of blurred vision or double vision, and probably the most important one is the R, and that's react. That's call 911. We're very fortunate here at CDH and Northwestern to be a comprehensive stroke center. We have unbelievable physicians that go in and take blood clots out of your brain while you're having a stroke. We have a mobile stroke unit here that goes to the house. And
that thing is unbelievable. You showed us that a few years ago, this gigantic truck.
Yeah, with a CAT scan right in it.
Incredible.
Yeah. But the importance of getting the stroke treated quickly is probably the most important thing. So if grandma or grandpa have any of these symptoms, it's not like, well, let's put them to bed and see if they're better in the morning. No, the importance is getting treatment as soon as possible to resolve those symptoms and to have just a minimal impact on their health going forward.
Next time we do this will be early January, so let's talk New Year's resolutions quickly here. You believe in micro-resolutions, things that are attainable, small steps, that kind of thing, like not cursing in church. That's a positive step. Driving to the health club, getting out of the car, walking to the door, touching the door, then go back to the car and drive home.
Nice.
At least you're making steps. Right. Or maybe you have better ideas, Doc.
No, you know what? I mean, people make these resolutions, and over 90% of them are gone before February. So what I say is do micro-resolutions, do small things for 30 days, pick 12 of them, and when you finish the month and you've done it, you have this sense of pride and accomplishment, and who knows, there might be some overlap as to some of these. And some of them are as simple as, hey, you know what? No fast food. I'm not going to have any fast food for a month. And look what happens to your weight as well as look at what happens to your wallet. You'll end up with more money. And just really you can very, very simple things. Taking a walk after dinner, doing a crossword puzzle. So remember there's mental health issues here. Putting the phones down before going to dinner with your family and kids, and you have great conversations. Making sure you have fresh fruit or fresh vegetables at least once in a day during a month. All of these are little things you can do that you have a sense of pride and accomplishment at the end of the month, and who knows how you're going to feel as far as continuing those going forward.
You can also do it charitably, right?
Absolutely. And if you do it, charitable ones, those are great because it gives your kids an opportunity to understand what goes on. Here at CDH, we have a tradition of delivering Thanksgiving meals to families, and the doctors and their kids do the deliveries. And I can't tell you how many doctors have come up to you and said, my kids now understand what's going on in the rest of the world and what's going on even in their own community, and how grateful and fortunate they are.
Well, Dr. Kevin Most, we are grateful and fortunate to have you as a friend, but also to have you as a resource to teach us. There's no way to quantify how many people you've helped in all these years of doing this. We're far from done. I know you're going to change your number a few times, but I will find you. I'm like Liam Neeson from Taken. I have a special set of skills.
Yeah.
I will find you. You will come back on the show. You will help others. But we'll do this again in early January, and we'll get on a schedule that works for you. And congratulations on taking this next step in your life. You deserve it. And thank you for everything you've done and everything you're still going to do.
Well, thanks. And, you've been a great friend for decades. And the opportunity to share any health-related stuff with whoever's listening and to talk about health-related issues just keeps us all a little bit healthier, hopefully. And hopefully I made an impact on some people's lives. And you guys have been such great friends, and we'll continue to. And AD, you owe me lunch still.
I certainly do. You are the best. Thank you, Dr.
I
Most.
thought he wanted to eat less.
I do. No, he wants...
He's always been in great shape. No, he can't stop eating. I'm worried about him.
We're going for salads.
Okay.
That's what we're doing.
Thank you, buddy.
You got it, guys. Take care.
Merry Christmas.
You too. Bye.
There you go.
Merry Christmas, Dr. Most. He's the best. What he means, I started seeing a new doctor at his recommendation, and the doctor said, "Oh, the new doctor's fantastic," and she said, "Oh, Dr. Most, he had called and
He's a legend.
Made the appointment, and they all were abuzz because he's the best.
Yeah,
the best."
You're going for salad. You could go to my new restaurant.
Oh God, what is it?
What do you have that kind
Because
of
I thought
Yeah, really? Oh, God.
God,
what is it?
What restaurant?
And Nick and I involved in a lot of businesses, and we've invested in a new chain called Just Dressing. And you bring out bowls of your favorite dressing and a spoon.
Yeah.
That was the drum roll.
Yeah, it's exactly right. Like, what kind of dressing do you like in your salad?
Ranch.
Imagine a bowl of ranch with no lettuce to get in the way.
Oh, that does sound good.
Yeah, see?
Ranch.
Yeah, not such a terrible
Ranch.
idea now, is it?
Now I have something to dip my fries in.
Yeah, that's what I'm talking about. And yes, you can get a straw. Straws are not optional. Straws are available.